Hello. Welcome to Creating a Culture of Care Week programming presented by the University of Louisiana System. I'm Dr. Kevin Yaudes. I've served the past few years as the University of Louisiana mental health content expert. I'm the outgoing chair of the Mental Health Advisory Council for the system, and I'm the department head for the Department of Psychology and Counseling at McNeese State University. I'm pleased to present Mental Health 101, which is the first program for Creating a Culture of Care Week. Also, you can feel free to put questions in the chat, and I will get to those questions at the end of this presentation. So, Mental Health 101. So a quick overview, we're going to talk about the importance of mental health, scope and prevalence of mental health, and how to promote mental health as well. So importance, mental health is just as important as physical health. When we are feeling ill, we know that we should likely go get checked by a provider. The same is not necessarily true regarding mental health. And scope and prevalence, we're going to talk about the fact that mental health concerns are much more common than people tend to believe, and also promoting what you could do as an individual for yourself, for an organization you're a part of, or maybe for a system, perhaps a school system that you are a part of, to address not just your own mental health concerns, but also those of others that you work with. Okay. So I'm going to start with a definition of mental health. When we talk about mental health, people typically are talking about mental health issues or mental health disorders. So it's not coming from a growth mindset. And one of the reasons that happens is the stigma around mental health. I will mention that throughout this presentation as well. So even though mental health and mental health disciplines seem to be moving in the direction of a growth mindset, mental wellness, you will hear me talking about mental health concerns, issues, disorders throughout this, because we're certainly not there yet. There's a tremendous amount of stigma surrounding not just mental health, but seeking mental health services as well. So definition. Mental health is, it encompasses emotional, psychological, and social well-being. So it influences our thought processes, our emotional state, and also our behavior, what we do. And it's more than just the absence of illness. And again, that goes back to current conversations seem to be focused around mental health illness, mental health disorders, but it really is all encompassing, including positive emotion, maintaining productive relationships, and achieving well-being. Okay, so we're going to start with a number of mental health myths and facts. So the first myth we're going to talk about is medication is the only treatment for mental health disorders. So I've certainly heard this as a clinician. I'm also a licensed professional counselor, that if I am concerned about my own mental health, or if I'm struggling with my own mental health, I want to go to a provider and get a medication that will take care of it. And that's one type of treatment, but treatment can also include therapy, changes in your lifestyle, incorporating more coping mechanisms, support networks, maybe increasing the size of our support network, or considering who is in our support network, and whether someone who's in our support network who might provide support in one way is able to offer support regarding mental health as well. We might need to think about who is in our support network and what role do they serve. So it's not just medication. And research seems to indicate over the years that therapy, seeking out therapy for mental health concerns in addition to medication, seems to be a winning combination. That's not to say that everybody should, anyone who is concerned about their own mental wellness should seek out therapy and also be on medication. Not saying that, but that combination seems to do well for a majority of people. Another myth, people with mental health issues can't work or lead successful lives. And I think this myth is certainly reinforced by TV and film, and you'll hear me say that throughout this presentation too. So in TV and film, what we tend to see as the viewer are the bigger mental health issues, significant mental health issues, perhaps schizophrenia or one of the schizophrenia spectrum disorders as well. So in presenting that on TV and film, the population tends to get the message that all mental health concerns are at the level of one of the bigger disorders like bipolar 1, bipolar 2, schizophrenia, which I've already mentioned. And that's certainly not the case. So TV and film certainly contribute to this myth. And the fact is that individuals with mental health conditions or concerns often are able to lead rich and fulfilling lives once they seek treatment in whatever way they prefer and whatever treatment works for them. So it's certainly not a situation where a mental illness has to negatively impact work or relationships or any environmental concerns throughout someone's life. Many mental health issues are also what we call episodic too. So some are certainly chronic. Schizophrenia would fall under that, would be chronic, but many mental health concerns, many of the depressive disorders can be episodic. And so when that is treated with therapy, with medication, with whatever is whatever works for an individual client, they can go on to, again, have successful life. Another myth, talking about mental health makes it worse. And so I do a tremendous amount of work with suicide prevention. And so I tend to talk about this myth in terms of suicide and suicide prevention. So as with mental health, I have heard many times that if we're talking about suicide, can't that put somebody at risk? And the fact is that is just not true. So the fact is open discussions can reduce stigma and encourage help seeking. And that can also be true if you're talking in a group and someone is openly sharing their own struggles with their own mental health. Maybe there's another person in the group who's quiet, not saying much, but even hearing someone else talk openly about it can be supportive to someone who's struggling in silence, because they get to see it modeled that, oh, this person that I know is talking about their own mental health concerns and they're being received with support. If it were true that talking about mental health or about suicide could make the situation worse, and what we're usually talking about is people, the way that I hear about it with suicide is that we're putting the idea in someone's head, then there really would be little use for counseling or therapy, right? So as a counselor, if I was working with a suicidal individual and all I had to do was talk to them about their issue and resolve that, then every counselor would see their clients for 1, maybe 2 sessions. So it doesn't work that way for counseling in a positive direction. So it certainly doesn't work that way in the opposite direction either. So talking about mental health is not going to make the situation worse. It's going to allow someone to realize that, wow, this person is listening to what I'm saying, and feel support in that moment, and maybe that's the support they need to then seek out the help of a professional. Another myth is mental health problems are all in your head and not real illnesses. And this is a stigma around mental health that is very long-standing. And many times I hear about it in terms of with men in mental health, that and it's the messages we receive when we're younger. Rub some dirt on it. Pull yourself up by your bootstraps. There's an idea that if it's a mental health concern, that being tough enough will be good enough in order to overcome a mental health challenge that we're having in the moment, or maybe long term as well. And that's not how that works. So mental illness can have biological, genetic, and environmental causes as well. And we're going to get to that in a few slides. Another myth, you can't prevent mental health disorders. So some, not all, but some mental health problems can be prevented through early intervention and lifestyle choices. And so early intervention, I will say this again throughout this presentation too, we know that early intervention leads to better outcomes for physical health. And we're not quite there yet with mental health, but the same is true of mental health, that somebody is struggling with is having signs and symptoms of something that could possibly be a depressive disorder, getting treatment and seeking help earlier is going to lead to better outcomes, the same way that it would for physical health as well. Also to preventing mental health disorders, when children, teenagers grow up in a household where there are a variety of coping skills, coping mechanisms modeled by parents, guardians, other family members, close friends, then that, because it's modeled for them, they're likely to incorporate that into their lives. And so if they are struggling with chronic stress, let's say at work, they may be more likely to go out for a bike ride than go outside and smoke. So the modeling of good lifestyle choices can be protective for an individual, so that concerns, challenges may not even get to the point where there's a crisis. Okay, a few more myths here. Another myth, people with mental health issues are violent. Again, I'll go back to TV and film. It's not unusual for TV and film to portray mental health issues, individuals with mental health challenges in a film, in a TV show, as being violent. And that is unfortunate because individuals with mental health issues are no more violent than anybody else in the population. It's just the images that we get, the messages that we receive suggest that people with mental health concerns are more violent than other people. In fact, the opposite is true, is that individuals with mental health challenges are more likely to be victims of violence themselves. Another myth, mental health problems are rare. I mentioned this earlier, that they're not rare. And in a few slides, I'll provide some statistics, but mental health issues are common. Millions of people are affected in the United States and also worldwide too. And so it's important to understand this point because as a clinician, what we would call this is normalizing it. We're not saying that it's okay to have a mental health issue. We're certainly not saying that if you're tough enough, then you can overcome this. But sometimes with individuals who are just starting to experience some concerns around their own mental health, they feel like they're alone. And so understanding the scope and the prevalence of mental health issues is very important. Another myth, you can just snap out of it if you have depression. Again, this goes back to stigma, and I'll go to men's mental health. The disciplines that comprise mental health professionals, or from which mental health professionals come, um, uh, we understand this, that it's not just a matter of snapping out of it. I will also say too that we can do and will do a better job with men's mental health going forward. However, those messages like pull yourself up by the bootstraps, rub some dirt on it, boys don't cry, that those messages we get typically when we're younger contribute to this myth that you can just snap out of it if you're strong enough. And the fact is that a depressive disorder, and there are multiple disorders, are medical conditions, and they're not a sign of weakness. And it often requires treatment. And again, back to what I was saying a few slides ago, that the treatment is going to be, the right treatment is going to be specific to the individual. So the treatment might be medication management. You might need to see a provider. It might be therapy, and it might be a combination of both. Another myth, only crazy people go to therapy. The fact is, therapy is a valuable resource for anyone who has a concern about their own mental health, or maybe even just something that is happening in their environment, something is happening in their life. One more time, early intervention is going to lead to better outcomes. So when individuals receive this message, they're less likely to seek out mental health services, and they may be more likely to wait until there's a crisis in order to seek out help if they had sought help earlier. And the average time from recognizing that an individual may have some mental health concerns to seeking treatment is 11 years. So as mental health as a discipline, we need to get better on shortening that time frame. Of course, stigma comes into play there. And the final myth that I'm going to mention is children can't have mental health problems. This is not true. Mental health issues can affect people of all ages, and also including children. It's particularly challenging for children with this myth in adolescence. As a clinician, adolescence, that's my favorite group to work with. And so this myth, what it really does is when a child or an adolescent is struggling with their own mental health and they share that information with a trusted adult, sometimes people don't believe them because they believe that, oh, children can have mental health problems or issues. And sometimes it can go as far as, what do you have to be sad about, depressed about? Because as adults, we're thinking about paying mortgages, about challenges of work, things like that. And we tend to diminish the challenges and issues that children or adolescents might have. So those are just some myths. There are certainly many more. So importance of mental health. Mental health influences our overall health, including our physical health, productivity, quality of life. And I mentioned this before, that we understand with physical health that the assessment is the assessment. And so if we feel that something is physically wrong with us, we would likely go to a provider and get that checked out. And in getting that checked out, you might find that let's just say that maybe an individual is pre-diabetic. Well, you might notice that something is physically not right for you, but you don't know exactly what's going on. And so you go and you have the assessment, and then you get the information, you get that diagnosis. With mental health, it's the same thing too, that we may notice that something is, I often hear, off in my life, or we might not notice it. It might be somebody else who notices it in our life. But again, the assessment is really important. So going to see a therapist, for example, one of the possibilities for addressing your own mental health would help you to understand if this is just something that is a current stressor, maybe a new stressor, or if this is maybe indicative of something larger. So one of my favorite quotes, good mental health is not something you have, but something you do. So referencing one of the previous slides too, early intervention is going to lead to better outcomes. So the sooner we realize that good mental health is not something that you have, but it's something that you do, we can establish things in our lives like good coping skills, exercising, seeing friends on a regular basis, taking breaks from work, or maybe other stressful situations in our life. And by setting those behaviors up, a person might be less likely to experience a serious mental health challenge in their life. And even if they are experiencing a serious mental health issue, they're not starting from scratch. They already have a good basis to address their current mental health concerns because they've established coping mechanisms, those types of things in their life already. All right, so mental health in America. I mentioned before that mental health issues are common, and we tend to believe the opposite is true, that they're rare, which of course contributes to an individual with a mental health concern not wanting to share that information because they think they're alone, or they think that it is pretty rare. But based on some data from the National Institute for Mental Health, nearly 1 in 5 adults in 2020 experienced mental health concern, mental illness in 2020. So almost 20% of the population. One disorder in particular, major depression, also in 2020, also from the National Institute of Mental Health, about 21 21 million people in 2020 were impacted by major depression. And major depression is an actual disorder. So I just want to make that clear too, that we talk about depression as if it's a monolith, and it's not. There are depressive disorders. There are multiple disorders. And so another reason that you might want to seek out treatment too is to find out what you are actually being challenged by. So major depressive disorder is an actual disorder in 21 million people. Suicide in 2021 from the CDC, and everybody gets their suicide data from the CDC. The suicide rate was 14.04 per 100,000 individuals in the United States. Okay. So some common mental health disorders. So very common, again, as a clinician, to see anxiety disorders one more time. Similar to depression, depression is not a monolith. There are depressive disorders, same thing with anxiety. There's not just one anxiety disorder. No one is diagnosed with anxiety. It's a specific disorder, and there are a number of them. But if we're looking at all of the anxiety disorders in 2021, 31% of the population met the criteria for some type of anxiety disorder. Generalized anxiety disorder, which is not attached to one event or one person or one thing, and social anxiety disorder, which is exactly as it sounds, is anxiety around being in social situations. Perhaps speaking in public could be part of that. It's not all of it, but these are common disorders within on the anxiety spectrum. Major depression, I was just mentioning. Depressive disorders, so 7.8% of the population, and I believe this was also 2021, National Institute of Mental Health, major depressive disorder. It involves persistent sadness and hopelessness. That number is probably much higher, probably higher than what is reported. As I've mentioned a number of times, there are challenges specifically with men and mental health. And so the signs and symptoms that we typically associate with depression are very gendered. And so we tend to, sometimes even clinicians may forget that anger, expressing anger, anger that is unusual for that individual, is one of the potential symptoms for major depression. So that number is likely higher in reality. And bipolar disorder, 2.8% of the population in 2021. It causes extreme mood swings between mania and depression. And mania is, it's a period of time in which there's the individual affected, there's little need for sleep. In fact, it's usually mania is about 4 days of increased goal-directed and non-goal-directed activity. A person might wake up or get up at 2 in the morning and decide that they want to make brownies. But it's a lot of activity in a short amount of time. There can be grandiose thinking. There's certainly elevated thinking, feeling very good, and then depression, which we've talked about. I do want to mention that bipolar disorder, every now and then, one of the recognized mental health disorders seems to become very popular in the media, social media, and also TV and film. And bipolar disorder certainly has taken its time in the spotlight. And so there's a general thinking in public that these mood swings, and that is how we refer to it, but they are very rapid and possibly cycling from good mood in the morning, depression in the afternoon, maybe back to a good mood in the evening. And that's not what it is. It is not rapid cycling within a day like that. It's not, you'll hear people talk about, yeah, I was in a good mood an hour ago and now I'm depressed. That's probably not accurate. It's probably very, very situational. The good mood or the bad mood in this case is likely tied to very specific things and wouldn't meet criteria for mania or for depression. So the way we talk about mental health really, really matters. And bipolar disorder is a serious mental health issue. Substance use. So in the US, about 20 million adults 18 or over had or met the criteria for a substance use disorder in 2020. That's currently the way that we talk about it, substance use, not substance abuse. You will still see that, you will still hear that, but the disciplines that work with mental health, work with clients with mental health concerns, have moved away from abuse, that term abuse, to substance use to be more growth mind, to be more growth oriented. Um, Substance abuse certainly has a negative connotation where substance use in general can be challenging sometimes for family members to understand and maybe deal with a family member who may be concerned with their substance use. About 14.5% of adults reported binge drinking in the past month in the same year. And binge drinking is 5 or more drinks for a man in one occasion, and 4 or more drinks for a woman in one occasion. So that's binge drinking, and about 14.5% of adults. And then illicit drug use affected approximately 24 million adults in 2020, with marijuana being the most commonly used drug. Okay. So factors affecting mental health. So we're going to talk about genetics, environmental factors, and life factors as well. So genetics can play a role in somebody could be predisposed to a mental health condition. When you hear that, you usually hear it in terms, I usually hear it in terms of schizophrenia. So being predisposed to a disorder does not necessarily mean that an individual will be impacted by the disorder. When we talk about genetics, one more time, we talk about it almost as a monolith that you either have a gene that's going to cause a mental health disorder or you don't have a gene. And it's much more nuanced and subtle than that. It goes into epigenetics. If we're talking about genetics, biology is probably a larger term that genetics fits into. So somebody could be genetically predisposed to a disorder, but that does not mean that they will have that disorder in their lifetime. And some of what goes into some of the protective factors that go into not being impacted by that predisposition are the coping skills that somebody might have set up, support system that somebody might have set up. So whenever you hear somebody talk about, oh, it's genetics, it's going to be much more subtle than that and much more nuanced than that, but it would be a factor. Environmental factors as well, living conditions, access to healthcare, exposure to stressors, can all impact someone's mental health, mental well-being. Environmental factors such as living conditions could be living conditions where maybe there is substance, if we're talking about an adolescent, maybe there is substance use in the home. And so that environmental factor will have an impact on the child or on the adolescent. Access to healthcare, if you are living in a more remote area of the state, or rural area, you might not have a provider or a mental health professional close to you. You might have a 20-minute drive, 30-minute drive, which could be prohibitive if you are not easily able to access that care by leaving work early, by taking an appointment during the day, exposures to stressors too. So as a mental health professional, one of the things that I would do would be talk to somebody about what stressors do you have in your life. And of course, the general thinking is that let's reduce stressors, but that's easier said than done, right? So there might be some stressors that you might not be able to easily reduce or remove from your life. Let's say work again. And if work is, you're going through a time period where there's additional work on your plate, and so your stress is dramatically increased, you could talk to a supervisor about the work that's on your plate, but it might not be that easy. Just having a single conversation might not result in work being reassigned or your stressors being reduced. So environmental factors encompass many, many, many things. And then life experiences, trauma, abuse, loss may also contribute to mental health issues. I'm sure that many people watching this webinar today are familiar with ACEs, Adverse Childhood Experiences Survey, that was created by the CDC. And it's a short 10-question survey that just assesses for how many, what the nature of the childhood trauma that somebody might have experienced, because the greater the number of traumatic events in someone's life, the greater the chance that they're going to struggle with their own mental health, and not just mental health, the greater the chance that they're going to struggle with their own physical health as well. In fact, as far as ACEs is concerned, and again, a 10-question survey, there's many versions of ACEs. So higher ACEs number is also predictive of diabetes, for example. So these life experiences, trauma, abuse, loss of a loved one, loss of a friend, addressing them could be protective for an individual in the future. Okay. So the importance of early detection, and I mentioned this before, that with physical health, we know that addressing physical concerns earlier is going to lead to better outcomes. So, and I seem to be mentioning diabetes a lot, but if somebody recognizes some early signs of diabetes, even if they aren't making that connection themselves, and they go to their provider to get things checked out, and they are put on a course, maybe not of medication management, but maybe the treatment plan includes behavior changes, like physical exercise, coping skills like going out biking, which would also be physical exercise too, that they may stave off a diagnosis of diabetes, or they may never be diagnosed with diabetes. So that early detection is incredibly important to the course of the diagnosis. And the same thing is true with mental health issues as well. I've mentioned men and mental health many times during this webinar, and because there is such stigma around men seeking mental health assistance, what I have seen as a clinician is sometimes men will wait until there is a crisis, because that may be, to that individual, a legitimate reason to seek out external help, seek out that type of support. However, if the stigma was lessened and people reached out earlier, they might never get to the point of being in a crisis. And certainly that's what any mental health professional would want. So noticing symptoms early allows for timely treatment and intervention. Timely treatment is very important if we're talking about trauma with abuse, assault. Seeking timely treatment would allow an individual to process that individual event, if it was an individual event or a series of events, early, so that they could work through what has happened to them. And there may be a situation where maybe 5 years, 10 years later, they want to come back to therapy to address longer term effects, but addressing it early set them up for success when they want to return to therapy at a later date. Early intervention can prevent worsening of symptoms and greater suffering. And it can. So the icon here is a pill bottle. And so if the treatment plan includes medication management, that could address some of the physical signs and symptoms of a mental health issue, which may allow somebody to go to therapy, which is often referred to as talk therapy. So I can give an example of this as well with anxiety. I've worked with a number of clients where the anxiety was so great that the client was not able to look at me directly, would literally wring their hands in a way that seems maybe stereotypical because of TV and film, but that is what happens. I also find that the phone is a big challenge and concern with people with significant anxiety issues, that because it's the unknown, right? And now we have cell phones versus maybe 30, 40 years ago. So if an unknown call comes up, who is that? What could be happening? So if an individual with anxiety seeks out therapy and is also working with a provider, if they are put on medication management, that may provide enough of the relief of the physical signs and symptoms that they're feeling regarding the anxiety that they would be able to make some traction in therapy. And that is one thing as a clinician that I always cover in that first session, and certainly beyond, is when's the last time you saw a provider. And if I'm seeing signs of anxiety and if it's undiagnosed, I will bring it up again that maybe it's time to go see a provider, because with various with significant anxiety symptoms, it can be difficult to even have a conversation with an individual. And also, and I've mentioned this, seeking help quickly when you notice distress can make a big difference in recovery for the reasons that I've always mentioned. I will mention too that an individual experiencing a mental health concern may not recognize that that's what they're experiencing. So if an individual has diagnosed or undiagnosed anxiety disorder, and again, there are multiple disorders, if they grew up in a household where there was also anxiety, they might not notice that this is out of the norm. This is not normal. And so it may take someone external to them to indicate that, hey, this seems different for you. Can we talk about this? Right. So when do you need, when would it be a good idea to seek out a mental health professional? So in many cases, an individual's existing coping mechanisms might be enough to handle even a new stressor, an increased stress, or cumulative stressors. However, when that new increased or cumulative stressors overwhelm your current coping mechanisms, that's the time you might benefit from seeking professional help. And again, you might not notice it as the one going through a mental health challenge. You might not notice that your coping skills are overwhelmed and that what you used to do that worked for you is no longer working. It might be someone else in your sphere of influence. It might be a family member, it might be a friend, or it could be a provider. Medications for a depressive disorder are most commonly prescriptions are most commonly written by an OBGYN for women. So based on your individual situation, you might not be the one to notice it. It might be somebody else who notices it. And what they're typically looking for or typically recognizing is there's a change in behavior. Okay, you're looking for that change. All right, so call to action. So individual responsibility, what can an individual do? Take care of your mental health, make time for self-care activities like exercising, meditation. Not everyone is, as a clinician, I've found that not everyone is always open to meditation or mindfulness activities, but being able to quiet the mind and be able to spend some time by yourself, cultivating peace is going to benefit anyone, even if they're not currently in a mental health crisis or having a mental health struggle. Paying attention to warning signs is extremely important too. And again, we're talking about changes. So you might notice it, somebody else might notice it, your provider might notice it, but you're looking for changes in sleep, appetite, mood that it could indicate declining health. It can be difficult for an individual to notice these changes in themselves. And so it can be helpful for another person to speak up and share what they believe they're seeing. I want to underscore the reason that change in behavior is so important, because for depressive disorders, sleeping too much or sleeping too little is a criteria for many of the depressive disorders. So what does that even look like? What does that even mean? Too much or too little? It's going to be specific to the individual, and we're going to be looking for a change. So if somebody is normally sleeping 7 hours a night, but all of a sudden they are now sleeping 10 or 11 hours a night, that change could just be that they're getting caught. You can't really get caught up with the sleep deficit, but they feel like getting caught up, or maybe it is an adolescent, it's summer vacation, and so they're just sleeping longer. But that change is what you're looking for, and you want to, of course, situate it with that individual. And seeking out help, talking to a counselor, therapist, doctor, a provider, or a loved one if you're struggling with mental health issues. And really, if you're concerned about speaking up about your own mental health to someone you might be concerned would share that information. Counselors, there wouldn't be counseling without confidentiality, right? So counselors are not going to say anything, providers are not going to say anything. However, I understand that there is concern about mental health concerns being shared with others. So speak to the person that you're most comfortable with. And I've found as a clinician that many times people will feel comfortable speaking to someone in their church. It doesn't necessarily have to be the head pastor, but speaking to someone in their church, and then that initial conversation and receiving support from the person in your church can give someone enough support to go on to perhaps seek out the help of a professional. All right, so call to action, organizations. Organizations, and this is where the individual can get involved as well, encouraging your organization to prioritize mental health of employees, providing resources, building a supportive culture, just like we are doing this week with creating a Culture of Care Week for the University of Louisiana system. Mental health programs and policies, programs like counseling, training managers. It's not unusual for an organization to have an EAP, flexible work arrangements, some type of something that you can point to that shows that an organization is supportive of their employees' mental health. And stigma. And I've mentioned this throughout this presentation that organizations can encourage open conversations about mental health through programming, through maybe small groups, by responding appropriately when someone shares that they're struggling. So the stigma piece is going to wind its way through absolutely everything regarding mental health, and an organization can take a leadership role in reducing stigma by making it okay to talk about mental health. All right. So making a positive impact on mental health individuals. It can promote awareness through social media and community events. There are likely some type of events in in all of our communities that have a mental health that are focused on mental health. For example, maybe you've got a NAMI in your area, and if you are following them and aware of what they're doing, you could share that information. You could promote it yourself. You can volunteer with a local mental health organization. You can educate yourself about mental health as well. It's always good to have the facts because we are bombarded with images and messages from TV and film that give an inaccurate picture of what mental health is and what mental health disorders are. You can offer to support those in your own community who may be struggling. That can be an individual situation, or again, that could be through promoting volunteer educating in the public and advocating for mental health initiatives and policies. Organizations can implement mental health programs in the workplace. And I'm proud to say, again, that the University of Louisiana system has certainly done that with programming like creating a Culture of Care Week. We also provide free 1 hour suicide prevention trainings through the American Foundation for Suicide Prevention. Can provide training and resources for employees, just like I mentioned. Creating a stigma-free environment. That can be many things, but it could be not contributing to stigma around mental health issues, or maybe speaking up if you hear somebody say something like, and this is one of my least favorites, is "I'm so OCD." So there are certain phrases that are really common in the population. "I'm so OCD" is one of them. And we, as mental health professionals, for example, I wouldn't call someone with substance use concerns an addict. I wouldn't use that term anymore. We try not to take the disease or the disorder and make it the person, because the two are can be separable. People are more than their mental health concerns or mental health disorder that they've been diagnosed with or undiagnosed with. Um, creating a stigma-free environment and offer access to mental health services and support. So that's at the organizational level. So some mental health resources. National Suicide Prevention Lifeline. In about 2 years ago, the National Suicide Prevention Lifeline changed from an 800 number to 988, and it changed to 988 because it's much easier to remember 3 digits versus an entire 800 number, right? And this has been in place for 2 years, this past July, and there's early evidence that it's working. The call volume for 988, which was 1-800-273-8255, increased dramatically when the number switched to 988, much easier to remember. Crisis text line, you can text hello or just about anything. You could text veteran if you were a veteran. And you'd be connected to somebody who is trained to work with veterans to 741-741 for free. Both the National Suicide Prevention Lifeline and the Crisis Text Line are staffed by the same trained crisis counselors 24 hours a day, 7 days a week, 365 days a year. And these, even though for the National Suicide Prevention Lifeline, the word suicide is right in the title, and Crisis Text Line includes the word crisis, you don't have to be in immediate danger to reach out. You can just call or text, and you will be connected with a trained crisis counselor who can talk to you about what is going on with you right at the moment. I mentioned NAMI before, National Alliance on Mental Illness. There are NAMI chapters all throughout the United States. Depending on the chapter, they're going to offer varying degrees of education, advocacy, programming, and types of support as well. So NAMI is a great resource. Also, Mental Health America, and in the state of Louisiana, we have Mental Health America in Baton Rouge. Tremendous organization, offers many resources. They offer a free screening tool as well that you can easily access just by Googling Mental Health America, and you'll be able to access that screening tool. And they offer information on a number of mental health conditions. There's the SAMHSA National Helpline and the Trevor Project. And the Trevor Project is for LGBTQ youth. It is for crisis and suicide, but like all of the numbers on here and all the resources on here, you don't have to be in immediate danger in order to access that. The Trevor Project also has something very unique. So if an individual was accessing this through a desktop computer, if they hit escape, I believe it's 3 times, hit escape 3 times, the screen will switch out with just your desktop image, because for an adolescent, the concern, the mental health concern could be considering that they may fall under the LGBTQ umbrella. And for more local resources, on each one of our campuses has a counseling center. So you could, for some of our universities in the system, some staff and faculty can also go to the counseling center. In some situations, if it is funded through a student fee, that might not be the case, but you could reach out to your counseling center and find out what is the situation on your campus. You could reach out to your counseling center and find out what type of programming they have coming up, especially as most of our universities move toward the start of the fall 2024 semester. Wellness center, increasingly common for universities and for higher education to have wellness centers on campus. So again, that's that shift from illness to wellness. So if you've got a wellness center and you are struggling with your mental health, this may be something new or something that you're returning to as far as a coping skill, coping mechanism. And if you're not, getting engaged with the wellness center, maybe it includes a gym, may set you up for being able to handle stressors that come in the future. Blue Folder Initiative is part of the Creating a Culture of Care Week programming. And so I strongly encourage everyone to attend one of the Blue Folder initiative trainings that will occur this week. One is tomorrow on Tuesday, and the other is on Thursday. Blue Folder and some of our universities have something similar in place already. But what that does is it is training for faculty and staff about what to do if a student is in crisis. Because one thing that I hear quite a bit from faculty and staff is, I don't know what to do. So if you're looking to be supportive in an appropriate way to a student or maybe even a colleague, this training will outline how you can recognize someone in crisis and what to do in that situation, not necessarily in crisis, somebody who's struggling. And then the Mental Health Advisory Council, I mentioned I am the outgoing chair of the Mental Health Advisory Council for the University of Louisiana system. We have members from all 9 of our institutions and a great executive team. And if you are interested in getting involved in maybe a committee or a subcommittee within the Mental Health Advisory Council, I will put my information in the chat, and you can feel free to reach out to me about that. And thank you. So if you'd like any additional information, if you had a question that you weren't able to get into the chat, or you had a comment or question about Mental Health Advisory Council for the University of Louisiana system, feel free to reach out to me, and I'm sure we will continue this conversation. Thank you.